ultrasound really catches them by surprise. A lot of people, when they think about our procedures, they believe it's worse than it actually is. It really wasn't that bad.
I've had people say, I should have done this years ago.
Hi, I'm Dr. Gerard Day. I'm a vascular surgeon here in Cary, North Carolina, and today I want to talk about what it's really like to come to a vein clinic. A lot of people are nervous about their first visit, and most of the time it's not what they expect. So in this video, I have my team walk through what exactly happens when your first time visiting a vein clinic so you know exactly what to expect. When you walk into the clinic, these are the people you'll meet first.
Hi, I'm Shannon. I'm a medical assistant here.
My name is Imani. I'm also a medical assistant here.
Hi, my name's Taylor, and I'm the ultrasound tech here at USA Vein Clinics in Cary.
Most patients are surprised by one part of their visit.
I think a lot of times, like for initial visits, patients just expect to come in and tell us their concerns. But the way we can really see venous disease is through an ultrasound.
Yeah, I also agree with that. I think that the ultrasound really catches them by surprise.
In many settings, when someone comes in with leg symptoms, an ultrasound may be scheduled for a different day, so patients have to come back for answers. In our clinic, we try to make that process more streamlined. So if an ultrasound is needed, it's done during the same visit, and we review the results with you right away. Sometimes this catches patients off guard, but in the end, they're very appreciative because that means fewer visits, less waiting, and more clarity before you leave.
I feel like a lot of patients don't know exactly what the treatments are and don't know that varicose veins can be treated without removing them, because that is also another type of procedure that people can do. We do something different, which is less invasive and a lot simpler, I feel like, than going into full removal and surgery.
So what actually happens when you come in for your first visit?
So they first got taken back and they're asked us a bunch of preliminary questions that just gives us a scope on what's going on. And then they're taken for an ultrasound, and then the doctor comes in and then discusses their personal answers compared to the ultrasound, and then sees what they qualify for regarding venous treatment.
The medical assistants will greet them and go through a bunch of different questions with them, asking about their symptoms, and then they'll come in and see me and I will scan their leg veins. And from there, I will go and tell Dr. Day all about the scan, and he will make up their treatment plan. A treatment plan is something that will have pretty much your appointment dates and appointment scans in it for you, and have everything that you're going to get done.
There are a couple of simple things patients can do before their visit.
Yeah, so we usually ask our patients to drink as much water as they can. I think 3 bottles is normally the recommended amount, just so that we can get a better look of their veins on the ultrasound. And then we just ask that patients don't drink any caffeine the morning of their appointment.
The visit is thorough but straightforward.
It could take an hour and a half to 2 hours.
The initial visit tends to be a little bit longer, so I will lay the patient down on this bed behind me and start on their right leg. I start really high up in the right groin, and I kind of go all the way down the leg towards the ankle. So I'll do that on the right side and the left side. And then a patient will go to the stairs and I sit next to them and look at their superficial veins. So it's a very detailed first visit, but we get a lot done, and then the patient ends feeling like they are ready to start their procedures.
A lot of patients come in feeling nervous.
When it comes in for procedures, there are a few needles involved, but it's not as bad.
Yeah, we do have a lot of numbing agents to help keep the patient more comfortable, and then we do like to play a little, relaxing music to kind of get the vibe chill. And then we also have stress balls, and we're also really good at keeping conversations. So our patients usually feel pretty comfortable throughout their procedure.
So you can definitely tell when a patient has some nerves, but it's usually pretty easy to calm them down, especially with my role as an ultrasound tech, because it's not invasive, and I always warn them I'll be squeezing on their leg a little bit so they know what's coming.
One of the biggest concerns people have is feeling pressure.
Oh, they don't have to commit to any treatment. The option is totally up to them.
There's no procedures that happen that won't benefit the patient. The whole point is to have the patient have easier time walking, be more satisfied with their legs, and have better flow.
Is the ultrasound painful?
No, the ultrasound, it's basically they use a gel and a probe, which is a little jelly on your leg, but that's it.
What patients say after their visit is often surprising.
A lot of the time, they'll walk in nervous, but they'll leave the clinic feeling pretty relieved. A lot of people, when they think about our procedures, I think they believe it's worse than it actually is. So a lot of the time when we're done with their procedure, they'll express their relief and say that it really wasn't that bad and they didn't feel that much pain.
One part of the visit tends to surprise almost everyone.
Oh, a lot of times, okay, so for the procedures, it's more prep. That's what the majority of the procedure is. For example, our EVLT, which is with the laser, like 40 minutes of that entire procedure go to just prepping it, and then the actual laser doing its like magic is maybe about 10-20 seconds.
And also the ultrasound, maybe not necessarily the initial ultrasound, but a lot of the post ultrasounds that patients get after their procedures can range between 10 to 15 minutes, and it's just a quick visit and they're out the door.
I feel like usually the post visits, the patients are like, oh, I'm already done, because the initial visits when they come in are pretty lengthy. And then after they get their procedure done, they'll come in for a post visit that next week, and those are pretty quick. So they're like, oh, it's time to go, okay. And those are usually pretty quick and painless visits.
These are some of the most common symptoms we hear.
A lot of symptoms include difficulty or pain when walking or standing. A lot of our patients mention things like burning, numbness, cramping in their legs, restless leg syndrome, itchiness as well. They can also feel uncomfortable while sitting down for long periods of time. Just a lot of symptoms that impact their activities of daily living, whether it's going to the grocery store or simply standing at the sink doing dishes.
This is something we hear from a lot of patients who have been putting it off.
I've had people say, I should have done this years ago. Like, they've had those varicose veins for a long time and they regret like not coming in earlier.
Venous disease is a progressive disease. It can get worse over time, and the procedures that we offer help. Like, you can change your lifestyle while walking, but venous disease needs to be treated to get back to the point where you're able to help it.
Is it expensive normally when patients come in?
So it does depend on your insurance and what that will cover. Based off of what I've heard from patients that might have visited other clinics, we do have some cheaper options in regards to treating spider veins or visual cosmetic treatments.
At the end of the day, the goal is simple.
I think if you're having like any issues with your legs, any swelling, itchiness, if you have cosmetic issues, I think it's always best to just look at it. We offer free consultations. The cost is something that seems to be the biggest barrier. There are ways to just come in and just make sure, because once again, venous disease is a chronic progressive disease, and it's best just to know like what's going on rather than just leave it before it gets too bad.
We really don't want you to be nervous. Like I said, we're very friendly here and we love to see new patients and form connections with our patients. We love seeing you guys, so don't be nervous to come in here. We only want to help you with what you need help with. There's no pressure in getting any procedures done. We're not going to push anything onto you. However, like Shannon said, it is important to get your veins checked out if you are experiencing some of the symptoms that we mentioned before.
If you're scared to come in or nervous, I think our staff here at this clinic does a great job of easing those nerves. And as soon as you come in, you feel welcomed, and we get you through your visit and get that treatment plan out to you. And then from there, you just feel a lot better after you get your procedures done.
Just get your veins checked out so that you feel better.
Come get your veins checked. We'll help you with your leg pain if you have venous insufficiency.
All right, that's it. I hope this video was helpful. If it was, save this video. Feel free to like or subscribe to us. and follow us if you want more vein health education. All right, thank you.
I also agree with Matt. Sorry, can we redo that? Could you cut that out? Flying my face. Are you on?
Okay, ask it one more time.
Okay. Hi, Taylor. Yeah, I'm gonna interview you next.
Okay, wait. Okay. I forgot what you asked me.
Save this something, you know.
You can clip this, right? I hope you get something out of that.
This was helpful. If this was helpful.
You can.
What was? Yeah.
And then like the downtime of what they can do afterward. Like really? Everything is happening.
We should do a bloopers.
Yeah.
That
There you
would be
go.
funny.
Yeah. Oh, I'm gonna keep that.